How we doing, YouTube? Nick Pratap here from Next Gen Rehab, and in today's video I'm going to be going over working as a clinical exercise physiologist with cancer patients. Now, if you've been following me on my channel, you know I work as a clinical exercise physiologist primarily with cardiac patients, or I work in the cardiac rehab setting. And for the past couple years now, I've actually also been working with patients who have cancer, prostate cancer patients to be specific. All right, so I'm going to go ahead and talk a little bit about the career path, certifications that you might want to be considered getting, and how exercise prescription translates to working with cancer patients. Now, like I mentioned, it's been a couple of years now since I've been working with prostate cancer patients. If we go back a few steps, I have my certification as a ACSM clinical exercise physiologist. I went to school to get my bachelor's in kinesiology. And so to work as a clinical exercise physiologist in a cancer setting, it does also help to get to the ACSM cancer exercise trainer certificate. All right, and if you're interested, I can also do a video about that certification as well. But essentially what this certification helps teach you is working with cancer patients, right? How do you exercise someone that's on radiation therapy? How do you help individuals that are going through any sort of hormone therapy? How do you deal with some of the fatigue from some of these therapies like chemotherapy? What effects does it have in the body, right? Being on chemotherapy or radiation can have implications in the body, leading to fatigue. Sometimes the residual from chemotherapy can lead to some scarring in certain tissues in the body. So it helps you go over these aspects. Also, how to safely exercise patients that maybe have metastasized cancer. So if the cancer spread to different areas of the body, how to safely train those individuals. When you're on certain hormone therapies, patients are predisposed to things like osteoporosis, weaker bones. So how can you tailor an exercise program to safely exercise these individuals without causing injury? So going back to the setting that I work in, so again, I work primarily, or I do work with prostate cancer patients. So a typical session usually lasts for about an hour. We do an initial consultation. Before doing this consultation, I normally do what we call prepping the chart. So I'll go ahead and have a look at the patient's history. So again, we're working with patients that have maybe had a prostatectomy or the prostate removed. Maybe they're on what we call androgen deprivation therapy or hormone therapy to basically take testosterone down to zero in an attempt to prevent the cancer from growing and spreading, or they may be on some sort of radiation therapy, right, to kill those cancer cells. So all these different therapies do have their implications on the body, right? The big ones, obviously, if you've had a prostatectomy and incontinence issues, so we have to think about that when exercising with patients. With radiation, a lot of fatigue, especially when they're going through that 1 month to 1.5 month bout of external beam radiation therapy. How can you counsel the patient to, even though you feel tired, to still keep the body moving, maybe tailoring exercise in different ways. And then obviously with hormone therapy, patients are more susceptible to weight gain, strength loss, more susceptible to things like osteoporosis the longer you're on that therapy. So there's a lot of different things you have to take into account, right? There's a lot of specific exercise courses out there. So I did one actually based out of Australia that's specific to exercise therapy for prostate cancer patients, which I've found to be a very phenomenal course. And so again, once the initial phase is done of prepping the charts, we bring the clients in. Obviously, we also have been doing it virtually during the whole COVID time. So we're able to see clients from regions outside of where we are, which is nice as well. So patients don't have to worry about driving in. So we start again going through their history, not only their prostate cancer history. We'll do follow-up questions like, have you had blood work done to check your PSA levels? Have you had any scans done, bone scans, PET scans to make sure that the cancer hasn't spread around the body, CT scans, and then we'll also ask if they've had DEXA scans done to test the bone density, especially if they're on hormone therapy. So again, we'd want to know if the patient has a susceptibility to weaker bones, so that when we do give them exercises, that we don't increase their likelihood of injury or fracture, okay? So after going through their prostate history, we'll go through their general medical history. So, we do tend to see patients that on top of having the prostate cancer, they may have had heart issues, stents, bypass surgeries. There may be patients that are on certain medications, cholesterol medications, blood pressure medications, heart rate reducing medications like beta blockers, which I've talked about previously. They may have had lung issues, they may be smokers. So a lot of different things to take into context, right? And then, so using the information based on the prostate cancer history, using the information based on the medical history, then we go ahead and start devising a little bit of a plan, right? But before this, we do some exercise tests to just kind of get a baseline of where the client is. So we do a couple tests in our clinic. We do what we call the sit to stand test. So it's a time test, basically doing a squat out of a chair, 5 repetitions, time how long it takes. We do a balance test just to see where the balance is at. We do a walking test, so it's called a 3-meter walk test. So we get the patient do a fast walk, time and see how long it takes them to do that. And then we have a grip strength test. This one's only done obviously in the clinic because we have to use a grip strength caliper, and just to get a sense of where the forearm strength's at. All right. So once we get all this information, once we get their medical history, one thing I did forget to mention is prior to the consultation, we do have the patient fill out a questionnaire, which goes over what they're currently doing for exercise, how their symptoms are with things like fatigue, energy levels. We talk about things like incontinence as well. And obviously during the consultation, we'll bring that up too, right? So based on the therapy you're on, are you dealing with incontinence issues? Are you dealing with fatigue? Is there any pain? Do you have any bone metastases? How are your energy levels throughout the day? So we go over all these questions, again, going through the medical history, going through the prostate cancer history, any symptoms based on the therapies that they're on. Then we do the exercise testing, and then based on what they're currently doing for exercise, we'll go ahead and give them a prescription, right? And this is obviously where it's going to vary from person to person, but generally speaking, we're looking at getting some resistance training in, right? Sometimes we're seeing clients that have never stepped foot in a gym or picked up a weight, and then other times we're seeing patients that have been in the gym for most of their life. So again, looking at that wide spectrum, maybe starting a patient on a 1 to 2 day a week strength training program and progressing from there. If they're not doing any cardio, especially if there's someone that's on radiation therapy and they're just finding that they're sitting a lot, maybe just something as simple as trying to get up every hour and move around, and trying to go for a walk every night for 20 minutes to start, and just gradually building up like that, right? And again, when it comes to the actual prescription, it's going to really heavily rely on the therapies that the patient's on, as well as their other medical history, okay? And then, so once the plan's been put together, we send the patient off, and then we follow up in different intervals. So sometimes it's after a couple months, we do another Zoom call, or we bring them into the clinic if we're doing this in person. And generally speaking, in our clinic, it's about a year follow-up before we discharge the patient. So that's kind of what I do in terms of exercise therapy with the prostate cancer patients in a nutshell. I know with other clinics, and depending on the different types of cancer, another big one being breast cancer for women, the exercise therapies are the same. I know there are settings where you can also exercise with patients. So in my setting, we don't do that. We provide the prescription, and they can take that prescription to a trainer or apply it in their gym or apply it at home. But working as an exercise trainer, especially with the ACSM cancer exercise trainer certificate, you can also work with these patients in a one-to-one setting or in a group setting. Again, you'll have the knowledge on how to train patients if they've had bone metastases, if they're going through some of the treatments that I've been talking about. And then there's a lot of different courses out there that will allow you to specialize in certain areas. So like I mentioned, I've done one for prostate cancer patients and exercise therapy, but there's a whole list of other courses out there for different types of cancer as well. All right. So hopefully you found this video helpful. If you have any questions, feel free to leave them in the comment section below. Once again, this is Nick Pratap from Next Gen Rehabilitation, and we'll see you in the next video.